In the case of Bell's palsy, half of the patient's face is paralyzed, while in the case of a stroke, only the lower part of the patient's face is paralyzed, while the upper is not. A patient with a stroke is still able to wrinkle the forehead by raising the eyebrows. Why is it happening like that? The answer to this question in today's episode. To answer this question, we need to look at the anatomy. The lower part of our face receives impulses from the opposite hemisphere of the brain, while the upper part of our face receives impulses from both hemispheres. In the case of a stroke, the damage occurs in the brain, which means that the lower part of the face does not receive impulses, but the upper part of the face still gets them from the other hemisphere. In the case of Bell's palsy, the damage occurs lower down, which results in the lack of conduction of impulses to both the lower part of the face and the upper part of the face, regardless of which hemisphere they came from. That's why stroke patients can raise their eyebrows while Bell's palsy can't. In practice, this simple test is used in diagnosis. The doctor, usually in the ER, asks, "Sir, madam, can you raise your eyebrows?" And if you can raise your eyebrows, but the rest part of your half of the face is paralyzed, then it would suggest a central lesion, such as, for example, a stroke. But if the entire half of your face is paralyzed, including the forehead, so you cannot raise your eyebrows, it will give some clue towards the diagnosis of Bell's palsy. However, please remember that this is not the only test. There are a lot of things that should be checked, and you should never do a self-diagnosis at home. So if you experience a facial paralysis, whether it affects the whole half of your face or just the part of your face, you should always and immediately see a doctor. Okay, that will be all. Thank you for watching and see you next time.